Hello everyone, welcome to a step-by-step guide of designing a 3D printable surgical guide for dentium implants in the anterior zone using the Blue Sky Plan software. So let's get started. So the first step is to open the software. The software that we would be using today is Blue Sky Plan. Once you open the software, the first step is to drag drop the DICOM data. The best part about the uh, Blue Sky Plan software is you don't even have to unzip the zip file. You can directly drag drop the zip file and it directly opens it, which is quite convenient. So if you don't want to mess with these things, you can just leave it, but this helps you reduce the overall data that the machine has to process. You can reduce all the unnecessary data and click OK. So if you don't find this screen when you open the software, it generally starts with this screen. So you can use a shortcut F3, which helps you come to an implant tangential 3 view. So where you have 5 windows in all the cross sections. So the case today is of a patient who's fractured her lateral incisor and the central luckily it was a whole segment, so we have bonded it directly to the tooth, and the lateral is completely out of the socket and is quite brutally fractured, so we've decided to consider it for an implant. So the next step is to drag drop the patient's intraoral scan. So we take the upper scan and we drop it into the window. The software automatically detects that it's a maxilla, hit OK, and the automatic alignment happens. Most of the times you won't have to go into manual alignment, and it's quite accurate and it's intelligent enough to align it properly. So to check this, whether the alignment has been okay, you go to the section where you can see the occlusal view, and as you see, as the tooth disappears, the green line on it also completely coincides and disappears. You can come to the cross section and then scroll with the mouse scroll wheel and check whether the alignment is perfect or no. Looks pretty good. Okay, so let's start with our implant planning. So the first step is to toggle the visibility of the CBCT here, because we want to do a prosthetically driven planning. All right, so enter the surgical guide module by entering or clicking the surgical guide advanced module. Then let's add a tooth. We want to add a first quadrant lateral incisor. Now this is not something that is going to get replicated, but it's just a reference point. So I've picked up any lateral incisor from the available library. You can be as picky as you want in this step and spend as much time as you feel you want to. But I don't like to spend a lot of time because it's not something that I'm going to replicate in my prosthetic module, because if I want to, I'm going to mirror this lateral incisor over this and then use that as my reference point for creating a temporary for this tooth. In one of our videos, we will even show that where we are mirroring the other lateral incisor over this. As of now, we are just using this as a reference point to make sure that our screw hole comes lingually and not buccally, so that we can make a nice screw return prosthesis for the patient. Okay, so let's achieve a decent alignment without wasting a lot of time on it. At this point, if you wish, you can even get the patients lower in occlusion to check how well adjusted it is in the patient's occlusion also. We'll take that up as soon as we are done aligning this tooth. So, okay, let's extend it a little so that it embeds into the design better. Let's rotate it a little bit, slightly wider. Okay, so done. So this looks okay. So now we have the patient's lower scan. We drag drop the lower scan. As you see, the software is quite intelligent to identify the lower scan itself. You hit OK. Now, since the CBCT did not have a lower jaw entirely, it's not going to actually align well because it does not know what it should align to. So if you notice, there are hardly any teeth available in the lower, but still it did a decent job because we got an open mouth scan for this patient. So that's how the software is aligned, but we want to change it. We want this scan, which is the lower scan, to align to the patient's upper scan. All right, so we will click patient's lower scan and we will hit alignment to model, and the model would be the upper scan. You hit OK and see it snaps. You can toggle the visibility of the CBCT from here, and this gives you a fair idea that okay, how much space are you going to have, and does the crown design look okay or no. Okay, so as per the patient's occlusion at this stage, if we plan, it should be okay. So at this stage, what we would do is now we will lock the tooth. We will toggle the visibility of the lower scan off, and we will now start with the implant planning. So the first step is to add the implant. So you go for an icon that shows an implant and a plus sign. We are going to use a Dentium Superline 2 implant. So let's select a 4 by 10 millimeter as a beginning point, and let's, unfortunately, the Dentium's abutment library is not available on Blue Sky Plan, so we will use a custom abutment. We'll just randomly add a 15 millimeter length so that we have a fair idea of where the tooth is going to be and where the abutment would be. So you hit the panorama and just randomly place it in the region of the lateral incisor. So looking at this, we can see that okay, we have quite a lot of height. So you can right click, hit replace, and let's change it to 12 millimeters. Okay, so we would have sufficient uh, primary stability from the 2 or 3 millimeter of bone that's available over there. So as you can see, this is quite off over here. So let's change the angles based on the prosthetic module of it, and then we will go back into the cross sections and adjust that. Okay, so this looks like a good exit for that tooth, and let's get it a tad bit lingual. Okay, so implant modules are not visible, so we'll go to view, we'll go to panels, and we want to have implant list, view, guide, fabrication visible. All right, so let's lock this implant for now. Let's unlock this tooth and increase its thickness a little bit so that we have a fair idea because it was quite flat. All right, so let's lock this tooth now. So we have a fair idea that okay, whether the implant is coming right from the cingulum or no, this looks okay. Let's go back to cross sections and see what can we do at this stage to align it better. So the green line that you see over here is the model, upper model. The red shadow that you see is the virtual tooth that we have added and the implant over here. So let's unlock the implant by right clicking on it, and then let's slightly tilt it. Let's angle it a little more, buckle again. Let's check the intraoral scan. Looks okay, looks acceptable as of now. So imagine that if I reduce this abutment's length to about 8 millimeters, it would come right out of the cingulum exactly the way we want it. All right, so this looks okay. Let's go into the tangential view and check in 360 degrees whether how is the placement. So this is the buccal cortical plate, this is the lingual cortical plate. Though there is a fracture over there and we want to There is a fractured fragment also available at one point of time, and we want to try and dodge that fractured fragment for now at least. Let's verify it with the intraoral scan whether the angle is okay. Okay, still acceptable. Let's go to the tangential view. It's still too close to the. So as you can see, this is the central incisor, this is the lateral. Let's try and move this slightly more towards the central. Let's verify it with the cross section. So if I want to go away from the tooth, then I might have to angle it slightly in like this, which would give me a lot of bone support also. This is the buccal cortical plate. Let's go a millimeter or two apically. You can use the scale to measure about 1.8 millimeters. Let's go back to the tangential view and check. Decently close to the central incisor actually. Okay, so the implant position looks decent. Let's change the abutment. Let's increase the length to 12 just to check whether we're going to come out from the buccal or lingual. We do come out from the buccal as it looks right now. So the screw hole would also come buccal. So let's see if we change the angle to 15 degrees, then how does it work? Okay, let's tilt the 15 degrees palatally, almost entirely. This works pretty well. So if we use a 15-degree abutment, it shows that we would come right outside the cingulum and we would be able to create a beautiful screw retained prosthesis. All right, so then once you're happy with the position, let's go ahead, verify again. One last time, pretty centered into the bone. Okay, looks good. So now the next step is to toggle the visibility. Let's lock the implant. You can use this to make the tooth disappear. Now let's consider whether we would do, at this stage there is no need to do any virtual extraction because it's almost not there, the tooth. So we can go ahead like this. Let's go to the guide panel. Let's toggle the visibility of the guide tube. Unfortunately for Dentium, the parameters here are wrong. So the guide hole diameter for my printer is 5.65. The height is 3.5. The offset here is correct, which is 8.8 if you're using a Dentium digital full guide kit. Okay, so let's hit this. One more important thing is from time to time you should really try and save your work. So we'll try and save it on the desktop right now, because just in case if there is an error or anything, you don't lose the work. Okay, from here, let's go ahead. Let's go to the guide panel. The first step is deciding the insertion direction for your surgical guide. You have to always eyeball this, set the insertion direction from view. This view looks okay. Hit OK. Now let's go to draw curve. Do nothing. I got this covered because once we extract, that space is going to open up. So let's take about 2 or 3 teeth from the tooth. Let's start from the second premolar. Let's go till the lateral incisor here. So you have to hit the shift key and then keep on clicking as it keeps marking the dot. The moment it connects, it will snap and change the color. You hit right click. You want to make two because there are two sides. So you want to make two windows from which you can visualize whether the guide has seated perfectly or no. So try and make it like a cylinder where you want it to open. Try and extend it, make it of any length, it doesn't matter really. So you can leave this like this, or of course it bothers you, then you can always reduce its length, but keep it slightly more. Let's add the second window. Approximate sizes, approximately in center from the guide tube to the where the guide is ending. All right, looks okay. Let's extend this a little bit buccolingually, and let's hit create surgical guide. So now the software does its magic and you have your surgical guide ready with the guide holes from where you can visualize whether the guide is seated completely or no. See, this is how you can verify in future. Okay, so the last step is to add the patient's name so that you can identify in future that the guide belongs to whom. So we would add the patient's name here. You can increase the font size by zooming in and out on the model. If you zoom in on the model, the font would be smaller. If you zoom out, the fonts would be larger. All right, hit apply text. I want to emboss it because I found that it's way more legible this way than rather than engraving it. So last step is save surgical guide. It's going to tell you that it's going to use 1 credit point for this. Hit OK, click yes. Let's go on the desktop and check whether the guide is ready. And yeah, this is how the guide looks like. And now we take this guide for 3D printing. Once the 3D printing is done, the guide is ready for surgery. Thank you.